What is the impact of OT in perinatal mental health care? Can we say the long-term plan monies are being well spent? Using a literature search, I address this issue through answering three critical questions. Firstly, has the OT profession embraced this aspect of healthcare within its philosophy? Well, over the past 25 years, the profession has gradually recognised perinatal mental health as a key area for OT, which can be observed in available literature. Early studies indicate it emerged from a recognition of mothering occupations and occupational science. Literature followed describing the importance of co-occupations between mothers and babies and later the impact of mental health on parenting. Coinciding with shocking reports published in 2012, the profession appears to start articulating how OTs could respond. With the long-term plan monies increasing the number of perinatal OTs, more recognition becomes evident. For example, the Royal College of Occupational Therapy and Health Education England produced an innovative online learning package. The perinatal mental health section is created. OT textbooks start to contain perinatal examples, and there's more presentations in the subject at our conferences. Question 2. How are OTs addressing the needs of new mothers within the practice? Well, whilst there is potential for many roles, literature only tends to focus on OTs directly working in particular aspects of maternal occupations. These include breastfeeding, emotional well-being through lifestyle management groups, improving parent-child bonding through co-occupations, training in undertaking parenting occupations, management of physical health through equipment provision, and co-facilitation of psychoeducational groups as part of the MDT. Thirdly, are we able to say how OT is supporting the recovery of women with perinatal mental illness? This was much more difficult to answer, as much of the literature is related to either OT theory or potential rather than actual OT roles. Others share good practice but no outcome. Positively though, as the profession grows, so does the amount of evidence-based literature. More recently, some studies are demonstrating how OTs can assist changing this client group. In conclusion, what is the impact of OT? Well, this literature search suggests the following. OT has embraced the specialism and does appear to be prioritising its importance. We are beginning to address the needs of new mothers, but OT has probably not reached its full potential in the maternal pathway. It is still hard to ascertain the effectiveness due to limited evidence. So have the long-term money been well spent? At present, it's not fully possible to answer this question. Therefore, OT should continue to develop perinatal mental health services, find ways to demonstrate its impact, and publish their results.